I was trying to figure out where to start the conversation because you have a long history in healthcare, in leadership positions, growing companies. Um, Maybe a good place to start is what brought you to MRO? I believe it was back in 2022, around that time frame. You had come off I think, the sale of a prior company, and
Yeah.
so you presumably had your pick of what you wanted to do next. Why did you choose MRO? What brought you to it?
Yeah, no, that's a great question. Yeah, so I'd been in healthcare for space for 20 plus years across providers, payers, value-based care work. And as you mentioned, I just sold a payment integrity business to a company called Discovery Health Partners to MultiPlan. And in my prior 20 plus years of healthcare, one of the things that I really noticed was an industry opportunity, was this kind of notion of interoperability. And specifically, in healthcare, we use and use claims data uh, for a lot of use cases that would be better supported by clinical data. And the constraint here, I mean, claims data is, affordable, it's ubiquitous, it's easy, kind of standardized. And if we could get that same level of liquidity for clinical data, we could make much better healthcare decisions, whether that's around clinical decisions or administrative decisions, revenue cycle, value-based care, dot, dot, dot. And so MRO grew up in the release of information space, and I would say we were adjacent to all these things, and we really have been helping providers for 20 plus years manage that exchange of getting clinical data, principally EMR data, not entirely EMR data, out of their systems for a couple of use cases. And the thing that struck me and the thesis from our investors was, if we could really introduce technology into this process, we could really start to help the healthcare industry unlock this trap data that was sitting in these, siloed systems, in some cases still sitting in file cabinets and sitting in various different disparate places, and make that data more available across the healthcare ecosystem, kind of in a high fidelity, low latency way, by really unlocking those systems. So that felt like a really big kind of problem to tackle. And so as a, business professional, you like to tackle big problems. And it also felt like one that would be highly impactful, or I knew would be highly impactful to the healthcare ecosystem if we were able to be successful. So it was meaningful mission as well. And I thought MRO was a really good kind of vantage point or starting point to build out on that journey. And uh, 3 years later, we haven't like fully cracked the code, but we are on that journey and doing a lot of good work. And hopefully, I know our providers and payer client partners appreciate the work that we're doing. But that's what really got me here, and is what keeps me excited about the mission and our opportunity in front of us.
And the company is supported by a private equity backer, Parthenon, a growth-oriented capital provider.
That's right.
And so you have to your disposal kind of different tactics to pursue organic as
Yeah.
well as inorganic. And I know you've been making some acquisitions. If we were to look at the composition of the company today, the solutions it provides, how would you characterize it? Maybe we can start with the most prevalent to maybe the more emerging.
Yeah. No, great question. So the way we think about the business, kind of broad enterprise clinical data management platform, helping providers, payers, and other consumers of clinical data get, again, that kind of low latency, high fidelity, secure, compliant access to clinical data for a number of use cases, which we can talk about. And then that kind of breaks down into two business units within the company. One which we call Exchange Solutions, which is all about how do we do that clinical data exchange on behalf of providers, helping them with use cases like continuity of care, helping them manage their payer partner relationships for things like revenue cycle and supporting claims and denials and making sure they get paid the right amount for the services that the clinically necessary services that they render. And so that's probably about 60% of our business today. And then we have a curation solutions business, which is all about how do we support providers improving their clinical operations and supporting their quality registry submissions for big service lines like oncology, cardiology. And so we are supporting that work and helping them improve those service lines to drive better patient outcomes within their provider networks. And as part of that core work, we then support payers and other parties. So payers, we support them with their risk and quality efforts. And we are increasingly growing into other kind of emerging solutions, for instance, like helping life sciences firms identify patients that meet certain criteria for clinical trials. And so we can leverage our connectivity and access with providers to be able to empower or power all these downstream use cases that the whole healthcare ecosystem can benefit from if we can leverage and unlock the clinical data that resides in all these systems. And so that's the business today. We'll continue to expand out into a lot of these other use cases like life sciences. We'll continue to expand within our payer client partners as well as our provider client partners.
I'm curious because, the topic du jour is AI and how each health tech company is approaching AI. Do you think it's an imminent thing? Is it a gradual kind of iterative process? How are you incorporating AI into your everyday?
Yeah. No, that's it's a great question. Like everyone, we are, on this journey and diving in relatively aggressively. And so I would think about it in a couple of different categories. There's one, how are we just adopting AI in our core business processes? So it's how do we use it to code quicker, faster, better? How do we use it in our financial operations, legal operations, call center operations? So there's all that kind of, can you consume AI as it's being developed from your partners that you work with to improve your business operations? And then the area that we're probably most excited about, as most people are, is then how do you develop AI solutions on top of or infuse AI into your core solutions or develop new solutions on top of AI, whether that be co-pilot type solutions or agentic solutions. And so what we've been able to do is run a host of early, what I would say are experiments, leveraging AI to allow us to do what we do better, faster, kind of higher fidelity. So about 6 months ago, we released an AI product that helps us do a lot of the quality control that we had been doing with some technology and with manual work. But we're doing a sampling of records or data that we may send out for QC. Now with AI, we've been able to go deeper, look at more records, increase the fidelity of the QC that we're doing. We're increasing to invest in AI and other automation opportunities to make sure that we can develop or to ensure that we're developing better solutions on top of our core offerings today. And so we've got a number of pilots in the market right now where we're leveraging AI to enhance our existing capabilities. So early returns are very exciting. We think there's a lot of potential and promise in AI. And like most people, I think we're still in the early days of building, testing, learning, experimenting, and going on that journey with our clients too. Obviously, providers are doing that same thing within their four walls. And so we want to make sure that we are aligned with them as we go on that journey with them to be able to deploy these solutions.
Mhm. You're a corporate leader multiple times over, and I'd be interested to hear about your maybe reflections on your time as an early leader, maybe earlier in your career,
Yeah.
leading a big group versus now. And what you maybe pay more attention to now, and what maybe you pay less attention to that you paid a lot of attention to in the beginning.
That is a fantastic uh, question. Uh, uh, I think, early on, you never stop kind of feeling all the, I would say, nervousness of running an organization and the weight and pressure of that. Um, but as you've done it a little bit more, you've got pattern recognition and you feel, I guess, a little bit more confident in seats. So that's probably one thing. But I would certainly say that the thing I'd probably index more towards now than I didn't before is around culture, um, team building, team leadership. I grew up, started my career in strategy and M&A, and so kind of led with that analytical part early in my career, and probably in my first leadership role, you kind of still lean on that. Now I would say it's almost the other. It's all about team. It's all about culture. It's how are people feeling. And if anybody knows me like that, that tapping into that part of me is not natural. But I was telling a friend here recently, like, I feel like probably 60% of the stuff I lean on today are lessons I learned playing sports growing up. And so, because it does become back to leadership, how do you motivate people? How do you get a group of people rowing in the same direction, working towards the same target? Help, share in the wins, acknowledge people's successes. There's all those things that, now I focus more on versus early. It was like, well, what's the right answer? And of course I can, lean on that and do that. But now it's really about people and team and culture.
Hmm. Are there certain traits that you look for in people as you're interviewing kind of key candidates for top positions?
There is humble and hungry, I think, is usually at the top of my list. I try to build, we here at MRO, I think, have a low ego for sure culture, one that's always hopefully focused on the greater good. So you want people that got a lot of humility, um, can suppress kind of the I for we, and then hungry. Anyone that knows me, like even today, I still have a big chip on my shoulder. And so you want people that wake up every day, um, uh, ready to go after it. And so we've got a lot of that. And then just good athletes, like, you know, high IQ, highly capable individuals that we can stretch and grow and create more opportunities for. And so those would probably be the top of the list.
After executives achieve a certain amount of success, there is this temptation maybe to take your foot off the gas and maybe be involved in other things. I mean, you're definitely involved in other things, but what drives you?
Yeah, that's another really good question. I think there is I mentioned kind of having a chip on my shoulder. I didn't grow up with much of anything. Um, Certainly statistically should not be kind of in the seat that I am. And so there's an acknowledgement that I've been fortunate, blessed to have this opportunity. Um, I know my parents and grandparents grew up in the segregated South, and this is an opportunity my grandfather was a World War II veteran, couldn't have dreamed of even having. So you stand on their shoulders, and with the opportunity comes responsibility. And so every day I try to make good on the opportunity and the responsibility. So I'd say that's one. Two, I am like extremely competitive. Probably to a fault. I don't let my kids win at anything. So 4-year-old, I don't care. I'm not letting you get anything. And so that translates into business, and we've got competitors, and I think we have a better solution, and I don't want them to win. And so there's a bit of that. And I do think, to your point, it is a trap I've seen executives walk into. As you get more success, there's 1,000 different things you can do professionally or just hobbies. Like, you can always find ways to spend money. And I just try to keep it simple, keep it boring. And as I always say, keep the main thing the main thing. Because these seats are rented. Like, at some point I'll be done and it'll be the next generation and they'll be in whatever, um, either this company or whatever this company has kind of become. So you sit in this seat for a period of time and you are steward over it. And while you have the opportunity, be all in. And in the words of the great poet philosopher Eminem, when your run is over, recognize it's at its end and, let someone else kind of play the game. So, but while I'm here, I want to be all in.
Presumably there's multiple areas of the business you're working on to help scale it. But if there was one, it's like someone once said, if you go to the constraint, focus on the constraint and that helps unlock, the
Yeah.
business. Like what would that constraint be? There's probably
Yeah.
multiple, but is there
Yeah.
one you're focused on?
Yeah. Uh, that fantastic question. I can't remember the name of the book, but yeah, it's like to find the leverage point. Not a mentor that used to always say that you can find the leverage point, kind of how do you unlock that. And I think if I think about the leverage point in the kind of macro picture of what we're trying to do in terms of unlocking trapped data and making that data available, secure, compliant manner, it is really around automation, and how are we able to safely and securely automate some of that clinical data exchange, clinical data curation, to be able to help our providers and payer client partners do more faster. I always say this is an industry that's not demand constrained, it's supply constrained. Like there is vastly more demand for the data and insights that we can derive from the data. The challenge is, or the constraint is, how do you get enough of supply? And the supply constraint really is about unlocking it, pulling it together from disparate systems. There's obviously a privacy security component of that, and then being able to leverage that for downstream insights, analytics, and power different use cases. So that's really been the leverage point that we've been focused on as a company over the last few years, and what's really driven a lot of the success that we've been able to have. We certainly haven't concluded the mission, but it's been a good returns on our starts.